Hello, and welcome to a presentation entitled Why Do I Hurt? A Look into the Human Pain Experience. My name is Sarah Owens. I'm a physical therapist assistant practicing for professional therapy services in Morton, Illinois. I'm also a therapeutic pain specialist, and today we're going to look at current statistics on pain and chronic pain in the United States, the process behind why we feel pain and why some of us may experience longer lasting pain than our friends or our family, what you can do to help your pain, and then look at some additional resources. So when we talk about chronic pain is generally referred to as pain that lasts longer than 12 weeks. So let's say you sprain your ankle, it hurts for a few weeks. That's what we refer to as acute pain. Now, if you sprain your ankle and that pain continues to last beyond the 3-month mark, then we will refer to it as chronic pain. Sometimes our chronic pain that we have can be the result of an injury, but most of the time it's idiopathic, which means that we really don't know why we hurt. There was no injury, there's no reason why we hurt. We just woke up one day and our back started hurting or our neck started hurting. We know that in the United States, over a third of the US population is affected with chronic pain, and that's over 110 million Americans. And if we were to look at the costs, including medical management for chronic pain, as well as time missed from work, every year those costs are between $560 and $630 billion. So there's a lot of money in the chronic pain epidemic that we are experiencing. And we look at this chart here, over the last 3 months, over 50% of the US population has reported some form of musculoskeletal pain. Now, musculoskeletal pain is any kind of pain in a joint, your muscle, let's say your skin, anything like that. Now, obviously, lower back pain is one of the more common complaints of people, but right behind it is knee pain, followed with upper limb pain, shoulder pain, neck pain. So just generalize too that we aren't going to only focus on low back pain. We're talking about pain in every single part of the body. So how did we think pain worked? This is a model from the 1600s from Rene Descartes. It's a very simplistic view of pain, but what we thought way back when is that there was a pain generator, the fire, and that when a person stuck their foot in the fire, there was a nerve that sent the pain signal up to the brain, and that pain signal rang a little bell in your brain that made you take your foot out of the fire. But we know that pain is a lot more complicated than that. According to this model, there are 3 things that a person could do if they are experiencing pain. Well, and the first thing, and probably the most obvious for this gentleman here, is to take his foot out of the fire. So if it hurts to bend over and put on your shoes in the morning, just don't bend over and put on your shoes. If it hurts to walk around the grocery store, just don't walk around the grocery store. It's that fear of an activity that causes your pain. Well, just avoid it. If it hurts, don't do it. And we know that that is not possible. You have to bend over to put on your shoes. You have to be able to go to a grocery store. And what we know is that people who have persistent pain or chronic pain, when we avoid an activity for fear that it is going to make our pain worse, it can actually lead to even increased pain compared to what you usually have, as well as increased disability. So that obviously will not work for us as humans. The second thing that we can do, according to this model, to reduce our pain is to put out the fire. So think medications and injections. Well, all of us, I think, can relate to at least one person who has maybe taken a higher dose or a very heavy narcotic pain pill, such as Norco or Vicodin or morphine. And despite being on these pain pills, they still say that their pain isn't touched. In the last few years, for Medicare alone, we've seen over a 600% increase in steroid injections for back pain. Now, you would think with a 600% increase that we would see the rates of back pain going down, but they aren't going down. They're actually getting worse. Okay? So sometimes putting out the fire doesn't help. The last thing we can do, and probably the most aggressive, is we could cut the wire. Okay, so in essence, surgery to a body part that causes pain to be sent to the brain. Well, we know that surgery isn't always 100% successful. If pain worked like the way this picture shows, surgery would be 100% successful. According to recent research, we know that 20% of patients who undergo a lumbar discectomy either experience the same pain or worse pain following their surgery. On top of that, lumbar fusions only have a 50% success rate. Okay. So let's look at these statistics. It is documented that 40% of the population without back pain, when put into an MRI, will show a bulging disc. Okay. Once we hit the age of 70, 2 out of every 3 of us have a rotator cuff tear, but they have no pain. Now that's pretty interesting, because if you talk to anybody who knows that they have a rotator cuff tear or has shoulder pain, it's pretty significant. So the amount of tissue damage doesn't always warrant the amount of pain that we have. Think about a paper cut. Is there a lot of tissue damage with a paper cut? Well, no. But if you get citrus in that wound, or if you get hand sanitizer on that wound, that little paper cut really lights up and it's very painful. Okay, so there isn't always a correlation between the amount of damage, or considered through imaging the amount of damage, and the amount of pain that one feels. We know that there's only a 50% correlation between knee pain and arthritis. Some people have severe arthritis in their knee, but they can still function, they can still get to place because their knee doesn't bother them as much as somebody else. And that person whose knee pain really bothers them, on an MRI or an X-ray, might not show very much damage in that knee. We think of collegiate players and the NFL and the NBA, those people are very good at what they do, and they're very aggressive in their sports. We consider them very athletic. They should be, the prime of physical condition. But if we take the collegiate basketball players who have no pain in their knees, and we put them in an MRI machine and look at their knee and look at the images that are shown, over 35% of them are going to show a significant abnormality on that MRI report. But again, they have no pain. So tissue damage and tissue issues do not always explain our pain. So let's talk about arthritis and back pain. Once you hit about the age of 40, you're going to get arthritis. I'm sorry, but it's just a fact of life. Now think about it. When your hair starts to turn gray or your skin starts to wrinkle, does it hurt? It might hurt your pride a little bit when you look in the mirror, but physically, our hair turning gray and our skin wrinkling doesn't hurt. What arthritis is a wrinkling of the joints. It's a wrinkling of the inside of our body. It is a normal age-related change. And so as we age, the amount of arthritis we have increases, as shown by the green line on the graph. Now, you would think that with this graph, the more arthritis that we have, the more people are going to have back pain. But if you look at the blue curve, you see that most of the people who report back pain are around the age of 40 to 50. But those people have less arthritis than people who are 70. Okay? So the amount of arthritis that is in your joint is not indicative of the pain that you feel. So what do we currently know about pain? We know that there are no nerves that carry pain signals. In the medical profession, we are taught the term nociception, and somewhere along the lines, that term nociception and pain have become synonymous, even though they are two totally separate entities. We'll get a little bit more into that in this presentation. We also know that tissues heal, and that even when tissues heal, our nerves can become more sensitive and fire off a little more rapidly. We know pain is a normal human experience. It's what keeps you safe and keeps you away from danger. But living in pain is not normal, and nobody should discount your pain. your pain is real and there are things you can do about it. We also know that the more we know about pain, the less our pain will be, and we'll explore this in a future slide. But think back to that picture of that gentleman with his foot in the fire, okay? This is the way we actually feel pain. It's similar in a sense, but what we know is that there is a danger signal sent to the brain. Something happens and your nerves are going to go, hey brain, pay attention to me. Something's going on, what do I do? You're also going to get input into the brain from your environment. So where are you? What time of day is it? Who's around you? What's your mood like? All of that is going to get sent up to the brain, where the brain is going to take that information and scrutinize it and process it, and then spit out an altered behavior or pain. Okay? So let's think of it this way. If you stub your toe at home and nobody else is home, that toe is going to go, hey brain, pay attention to me. Something's happening. Your brain is going to scrutinize it. Maybe you have stubbed your toe before and it really did not feel the best. You had a lot of swelling. Your brain is going to go, oh my gosh, lift your foot up off the ground, squeeze it. It hurts, it hurts, it hurts. You might cry out in pain. You might jump up and down. You might say a few 4-letter words. Okay? But let's say that you stub your toe while you're at church. It's during service and everybody is really quiet. Are you going to have the same response that you do when you stub your toe at home when you're alone? More than likely not. Yes, you may still feel pain, but you're going to be able to dampen your response and dampen the amount of pain you feel, 1, so as not to disrupt church service, but 2, so as not to bring too much attention to yourself. There are more important things to focus on. Pain is our body's response to a perceived threat, and it's a way to protect us. Pain is an output of the brain. It is our body's response just to keep us safe. You do not have nerves that say, hey, she's hurting. Just like you don't have nerves in your foot that say, hey, she stepped on a rock, or hey, she stepped on a feather. That all comes from processing in the brain. Now, this is subconscious. This is not to say that the pain is all in your head, but it's just the way that our bodies work. So our body has a living, breathing alarm system. It is called our nervous system. We have the brain and the spinal cord and nerves. Now, if we were to take the nerves in your body and put them end to end, we know that that totals over 45 miles of nerves. So that is a long distance just to keep inside our bodies. Now, when your nerves are happy and when you are alive, they always have a little bit of electricity running through them. Every nerve also has something called a firing level. And that's when your nerve gets excited enough to send off a signal to the brain. So let's say that your nerve is buzzing along and something happens. Let's say you step on a rock or you put on your socks in the morning. That nerve is going to get more and more excited. That alarm is going to activate and it's going to send off a signal to the brain. The brain will scrutinize that information and put out your altered behavior or your response. Now, once that nerve has sent off a signal to the brain saying, hey, pay attention to me, something's going on, it will calm back down. But let's look at this example. If you were, for some reason, walking around in your yard barefoot and you stepped on a nail, would you want to know about it? Well, I hope so, because there's a couple things you need to do. One, I hope you pick up your foot off the ground, maybe take the nail out of your foot. You might apply first aid. You might go see your doctor to get a tetanus shot. Okay, so we're going to use this example for that living, breathing alarm system. So here's what happens. Your nerves are buzzing along as you walk in your yard. You accidentally step on a nail. That nerve gets really excited and it goes, hey, pay attention to me, brain. And it fires off that signal. The brain scrutinizes the information And then that nerve has done what its job was, to notify its superior, to notify the brain, and slowly that nerve calms back down to resting level. Now, as soon as you take the nail out of your foot, is the pain going to go away? No. Your foot is going to stay a little sensitive. It's going to make you more aware of your foot so that you pay more attention to where you're stepping to keep yourself safe. Okay? And it comes down over the course of days, maybe a couple weeks, and then eventually it levels out back at that normal resting level. We know that in 1 in 4 people, after your alarm activates, your nerves do not calm back down to a normal resting level. They stay extra sensitive. So when we think about an extra sensitive alarm system, before pain, you had a lot of space before that nerve would fire off a signal to the brain. Before you stepped on that nail, you were able to walk around the grocery store, maybe take a jog on the street, on concrete. Maybe you could walk around barefoot before your feet started to ache a little bit. But after you stepped on that nail and then your nerves did not calm back down to that resting level, you only have a little bit of room for activities. Now, getting out of bed in the morning and just putting weight on your feet is excruciating. You can barely walk to the bathroom. Okay? Nerves can increase their sensitivity. And it's not so much that you have a tissue problem where your foot didn't heal after you took out the nail. It's more that those nerves stayed sensitive. You have a sensitive alarm system. The common question that I get in the clinic is, why did the nerves get sensitive? Why is it that I hurt my back and my nerves stayed sensitive, but my friend hurt their back and they have no problem? Well, there's a couple different reasons, and we call these yellow flags. Our beliefs and our culture, how we're raised. We know that certain cultures are a little more stoic and certain other cultures are maybe a little bit more expressive when it comes to their emotions and their feelings. But what you know about pain, do you believe that this pain is detrimental? Have you experienced the pain before? Are you fearful of pain? Do you have anxiety? All of that can ramp up your nervous system and make you more sensitive because your body is going to perceive a larger threat than maybe somebody who doesn't have that fear and that anxiety around their pain. Past experiences. Did your mom have a bad back? Was she confined to a wheelchair? Or did your mom have a bad back, but she was able to work up into her 70s or 80s and lead a normal life? Failed treatments. How many times have you been to therapy, chiropractic care, or your doctor to address your pain and nothing helps? Every time you go, they try something different and nothing seems to manage your pain. You get prescribed one pain medication, it doesn't help, so you switch to another one and it still doesn't help. That can increase your fear and anxiety, and that can also increase your nerve sensitivity. Family issues can be a major proponent of why your nerves get sensitive. Do you have a spouse or a family that is supportive of you, or do you have one that kind of puts you off? Oh, you're fine. You're milking the system. You're faking it. You're fine. All of those words can affect how we feel in terms of our pain. There's actually studies that show mothers who coddle their children when they have an injury, those children grow up to have a higher incidence of chronic pain. Job issues. If you get hurt on the job, you are more likely to have more pain and disability if you get hurt on a job that you hate compared to a job that you love. And different explanations. Maybe you had shoulder pain and one professional said, oh, you have a little bit of a rotator cuff strain. So you go get an MRI and that MRI report shows full thickness tears, bursitis, rotator cuff tears, all of these big scary words. And when you go to the surgeon says, well, it doesn't look that bad. I don't think you need surgery. So then you go to therapy and maybe your therapist goes, I'm going to try to do what I can, but I really think you're going to need surgery. That's confusing to not only you, but to your body. Your body doesn't know what to expect, and that in turn can ramp up your sensitivity. Another common question that I get is, well, what can you do to calm my sensitive nerves? And there are three major components. One of them is medication, and this is something that you definitely need to speak with your doctor about. For this presentation, we're going to talk more about education and exercise. The more you know about pain, the less your pain will be. So this is called a functional MRI. And in the very top row, you will see a scan of a brain of a person laying quietly in the MRI machine. The middle row, where all those little red blobs are, they had this person do a motion that was painful for their back. They had them tilt their pelvis forward. All these areas of the brain lit up. What you're looking at in the middle row is pain. Okay? So what the researchers did in this case study is they pulled this person out of the machine. They gave them a talk on how pain works in the body, a lot more in depth than what we're doing here. And then they gave them a very basic exercise to work on for 2 weeks. After 2 weeks, they brought this person back in. They had him in the MRI machine, and they had him do that same motion that they did in the middle row. And look at the red blobs in the bottom row. There aren't as many, okay? The more that you know about pain, the less fearful you are of it and the less sensitive you are, and your pain can be reduced. Exercise. Now, I'll be the first to admit exercise is not everybody's favorite thing, and unfortunately, a lot of therapy places, when you go and you start doing exercises, it's always 2 sets of 10. But what happens when you can't do 2 sets of 10? Okay? When we talk about exercise, we want you to respect the pain but not be fearful of it. If you have hurt for a year, when we start moving that body part that you've avoided moving for a year, it's going to be a little sensitive. It is going to be sore, but just know that you're safe. Pain is not a sign of tissue damage. Hurt does not equal harm. If you haven't moved a body part in a year and you start moving it, those nerves are going to go, oh my gosh, what's going on? She hasn't moved this. Why are we doing this? And they're going to fire off more signals to the brain because they're trying to protect you. Okay? When you have chronic pain and you start exercise, there will be some discomfort, but don't be fearful of it. We're safe. And when we exercise, we want to touch the pain, tease the pain. You want to perform exercises or even daily tasks such as cleaning your house slightly into discomfort, but we need to avoid pushing past it. How did Tiger Woods get better at golf? Did every time he had a bad day, he stopped golfing? No. He kind of practiced a little more, and he kept touching and teasing those golf swings or the parts of the golf game that were hard for him to get better. If you've been in pain for a really long time, your body has gotten really good. It's practiced at being at pain. You are a professional athlete in being in pain, and now we have to teach your body how to not be in pain. We need to practice not being in pain, and we need to practice different activities to help our pain level. So what can physical therapy do for you? One is that we can come up with a program designed for you and not just your diagnosis. We'll talk a little bit more about this in a future slide. Besides exercise, physical therapy is a lot more. We can teach you relaxation and mindful techniques to reduce the sensitivity of your nerves. We can work on neurodynamics to improve the sliding and gliding of the nervous system within your body. We can talk to you about sleep hygiene, ways to improve your sleep. We know that people who sleep better, their pain rates are lower. And then there's also modalities, if needed, if we need to do an ultrasound or a hot pack or a TENS unit. But more importantly, what physical therapy does is it teaches you how to safely improve your activity tolerance without flaring your pain. Probably the biggest question that my front desk staff gets at my clinic is, don't I need an X-ray or an MRI before I start therapy? And actually, you really don't. The American College of Radiology guidelines recommends no imaging during the first 6 weeks of uncomplicated back pain. And the only things that indicate extra imaging are if you had trauma, let's say a fall or a car accident, findings suggestive of something a little more sinister, such as cancer or infection, or rapidly progressing neurological deficits. What we know is that oftentimes findings in MRIs and X-rays are normal age-related changes. They're the wrinkles on the inside. And they might be unrelated to the pain problem that you're having, but once we bring those to light, it can lead to further disability due to those perceptions of the findings. Let's say that you get an MRI of your back because you're having left-sided low back pain, and that MRI comes back and says that you have stenosis and maybe a right-sided disc bulge. Well, now you're constantly going to be worrying, and it's going to be in the back of your mind, well, when is the right side of my back going to start hurting? Okay? We know that anatomy does not always explain pain in terms of the chronic pain that we feel. Here's a study that looked at a few different groups. So they had a group of patients who had early X-rays, and they had a group of patients who had early MRI or CAT scans, and they compared those to a group who didn't receive any imaging. And at the end of this study, the patients who received the X-rays and the MRIs didn't get any better, any quicker than the patients who didn't have any imaging done prior to therapy. So what does this mean for you? A physical therapist can look at 1,000 X-ray reports of patients who have stenosis or MRIs that show herniated discs, but they're not going to give every patient the same exercises. Good physical therapists should treat the person and not the diagnosis. Just because you have stenosis doesn't mean I'm going to give your neighbor who also has stenosis the same exercise. We are human beings and we are different, and we want to focus on what your goals and your abilities are, not just what a piece of paper says about your back. And does exercise really help pain? It really, really does. We know that people who get just 10 minutes of aerobic exercise a day actually sleep better. They sleep deeper and they feel more rested. And in this article published in Clinical Geriatric Medicine in 2010, there were significant improvements in strength and function, as well as pain reduction in 8 different studies that were synthesized. So what the recommendations from this article were is that people who have OA or osteoarthritis should be reassured that it is unlikely for their pain to be made worse if those exercises are performed correctly and at the appropriate dose. Evidence shows that when proper exercise is performed, it can actually reduce pain associated with arthritis. So there is a safe way to exercise and move to help improve your function. And if exercise is making your pain worse, you probably are either doing too much, too little, or you're not doing the right exercise. Remember, you are an individual. The exercises that your neighbor does for their knee pain aren't the same exercises that you'll be doing for your knee pain. There are other benefits to exercise besides reducing pain. And we talked about improving your sleep quality. We know that when you exercise regularly, you can reduce your risk of falling, and it improves your walking speed. It preserves your bone density. It can also reduce your loss of muscle mass, and it can aid in weight loss, along with the other benefits noted on the screen. If you have any questions, please feel free to visit our website, ptsinc.org, to find a clinic near you and learn how to better manage your pain today. Thank you.